Breastfeeding is still the healthiest form of infant nutrition. Nowadays, nursing mothers don't give their infants the privilege of getting the necessary nutrients they deserve from their mother's milk. Some parents only depend on feeding their infants with evaporated cow milk and infant formulas, which they find more convenient and nutritious than human milk. The infants are being weaned from 5 to over 10 months, and their care is left over to someone who will give less concentration on the child.
Even after the 6 months of giving the child only breast milk, you still have to continue to give the child breast milk until up to 2 years of life. But what happens is that from after that 6 months, you have to introduce what we call complementary foods, because from 6 months of age, the breast milk will not be sufficient to meet the nutritional requirements of the child.
Some parents after childbirth neglect the feeding of their babies with human milk, thinking it's old-fashioned. When interviewed, Dr. Henry Clapton throws more light on the importance of exclusive breastfeeding.
The recommendation is that the child should be exclusively breastfed for the first 6 months of life. That's from birth till when the child reaches 6 months. And that what this exclusive breastfeeding means is that you give the child only breast milk, no water, no any other liquid, except if the patient is being given maybe multivit or some medication because of an illness.
Apart from the nutritional values of exclusive breastfeeding, it also prevents the infants from contracting diseases.
The breast milk effect contains all that the child needs in that first 6 months of life. Is sufficient to provide all the vitamins, the minerals, carbohydrate, fat, and even protein to sustain the child for that first 6 months of life.
If a mother breastfeeds her baby for 2 years, it increases the bond between the mother and the child. Hadiza Abbas, Gotal News.